this is your Houston chiropractor, Dr. Gregory Johnson, and we have Americo here with us this afternoon. And Americo's already had back surgery for a L5 lumbar herniated disc, and you've still been having problems 6 months even after that, right?
Actually, more problems.
More than that, since March, right?
Yes, sir.
Since in your low back, now you're getting pain down in your leg and numbness and tingling all the way down to your toes and your feet and pain in your pelvis, burning pain.
Burning pain all around.
Yep. So this is your very first visit here, right? We just met.
That's right.
All right. So we're going to show you how we fix up a first-time herniated disc patient who's already had back surgery. So let's take a look here in the mirror. Okay. Now I'm going to have you close your eyes for me, Americo, and flex your head forward and then backwards, please. And then neutral. What a great name, by the way. I can already tell you're a big side sleeper.
Yes.
Now, when you open your eyes, I don't want you to move. I only want you to look in the mirror with your eyes. Go ahead. Okay. So first thing I see is your head's way forward. Your ear's dropping right here in front of the clavicle. See? Right there. And it's supposed to be back here over your shoulder. That's why your shoulders are starting to round a little bit. But what's the most, see how your head's way right of center?
Oh, yeah.
Look how your right hand looks longer than your left one. It's not really, just looks that way. You see all the space you have here and how little space you have over here?
Yes.
So your pelvis and thoracic spine have shifted way left to center. Your head's gone right, so guess what's going on in the middle of all that? Curvature, all compensation. Yep. So let's lay you on your back here on this table. And I want to do some orthopedic neurological tests on you now. Head up that way. These are just going to be tests. I'm not going to treat you quite yet until we exactly narrow down the problem. So besides the tightness in your hamstring, do you feel any lower back pain or shooting leg pain when I'm doing this? Tell me if and when. Right there?
Yeah.
Okay. Now, tell me when it starts feeling better.
Yeah.
Okay, just relax your leg in my hand. Does that cause you to have any back pain or leg pain? Okay. And let's cause that one there. And I'm going to push down here. Tell me if this causes any hip pain or back pain. Okay, good. Now we're going to go on this side. And we're going to do the same thing, keeping your legs straight. And besides the tightness in your hamstring, tell me if and when that hurts your low back and leg.
It's starting.
It's starting to?
Yeah.
Is it going down your leg at all?
No.
Okay. Back worse? Does that make it worse? Okay. I'm going to make it worse. Better down here?
Mm-hmm.
Okay. Does that cause any back pain or leg pain?
No.
Okay. Let's cross that over. Tell me if that hurts in your hip or your back.
I mean,
Nothing? Okay, good. Okay, push against my hand. Pull up. Turn in. Turn out. Push with your big toe. And pull up with your big toe. Good. Okay, push. Pull up. Turn in. Turn out. And push big toe. Pull up big toe. Okay, good. Strength's okay. Let's lift your head up for me. Tell me if this hurts anywhere in the spine, anywhere.
No.
Okay, good. Let's sit up sideways and face that wall right there. There we go. Scooch over this way. You won't be on that crack. There you go. I'm going to push straight down here. Tell me if this causes any pain in your spine anywhere. Okay. Now I'm going to go backwards and to the right. How about this one?
No.
And now we're going to go backwards and to the left. How about this one?
No.
Okay, good. Now look straight ahead. I'm going to push down here, and I want you to hold this up. Good. Same thing here. Hold. Excellent. Okay. So now I'm just going to test your muscles here. Biceps first. I'm going to pull out, resist. Good. Relax. I'm going to reposition. Test your triceps. Good. Okay. Biceps first. Hold. And then triceps. Hold. Excellent. Good upper body strength and lower body strength, really. Do you notice that when you're going up and down steps that it weakens on you?
Yes,
Okay, so you're not really feeling the weakness part of it, you're just feeling the sensory part of it.
Yeah.
Okay. So see, his motor function is checking out okay. In fact, the reflexes in his patella is normal on both sides, +2 equal and active, as well as, just relax your foot. There you go. And relax your foot. Yep, good. Okay, now, can you walk on your tiptoes only about 3 steps that way for me, Americo? If you want to take your shoes off, you can. There you go. Yep, now your heels only, back towards me. There you go. Is that hard to do or hurt anywhere? No. Okay, good. If you can just bend over like you're going to touch the floor and tell me if and when that hurt your back anytime.
It's just tight.
Tight?
Yeah.
No pain though?
No.
Okay, how about when you're coming back up? Does it hurt coming back up?
No.
Okay, how about when you put your hands out in front of you like this and you lean straight back without bending your knees? Does that hurt your back?
No.
Okay, how about when we twist you to the left and I push you down? Does that hurt your back anymore?
No.
Okay, let's go to the right and back. Does that hurt your back anymore?
No.
Okay, so he's got negative Kemp's on both sides. Let's come over here on your tummy. He did have a positive straight leg raise on both sides for low back pain. Let's go on your tummy first.
Oh.
There you go. So we're entering the final part of the examination, which is the leg check. And see, his right leg is short by over half an inch. And when I bring it up, it actually gets even. I bet you that tightens up in your lower back right there.
Oh, yeah.
Yep, okay, so that tells me his sacroiliac is part of the problem, and I bet you that's tender right there.
Mm-hmm.
And these muscles are really tight right here. This is where you feel a lot of that coming right through there, huh?
Mm-hmm.
And there's L5 right there.
Oh,
That's sore, huh?
yeah. Oh, yeah.
Now, he had supposedly what's called the most minimally invasive surgery that is done in orthopedic or neurosurgery, correct?
Yes.
That's what they told you, right? Minimally invasive.
Correct.
So,
There.
what he's got though, and I can feel it, is scar tissue right down here in that L5S1 area. I bet you that's all sore.
Oh, yeah.
Okay, and you can feel that kind of that rough tissue right there.
Mm-hmm.
That's scar tissue. And it's worse on the right side right there.
That's where they went in.
That's where they went in right there? Okay, so you ready to feel better?
Oh, yeah.
Okay, so I'm going to start off by adjusting your right sacroiliac joint here, so just keep breathing. There you go. Uh-huh. So catch you on exhalation there. Good. Perfect. And just keep breathing. So what I'm going to do now is I'm going to adjust his sacrum straight down in the y-axis, superior to inferior. And that gets his sacrum away from L5, which he's pinching on the L5 nerve because he's getting numbness in his big toe, which is L5. And L4, L5 vertebra exits the L5 nerve. That was L4 and 5. Okay, let this one go. There's L4 again. There's L3, that one was probably pretty tender too. And there's L2, so we're going to work all the way up into here now. Just keep exhaling, breathe slowly though. There you go. Okay, yeah, just let all your air out. Oh yeah, there we go. I'm going to put your head down just a little bit to open these joints up. Same thing here. Perfect. Okay. I still got one right here. Yep, there it was. I knew it was there. Alright, so let's recheck your leg length, and they're exactly even now. And I bet you this feels a little easier already.
Oh, yeah.
Yep, good. Okay, so I'm going to pull out the heavy machinery on you. We're going to use the turbinator on you for the very first time. So just, it's going to be some deep tissue work, so just breathe and relax. Now, Marico's already had epidural steroid injections also, which were also ineffective, correct?
Correct.
Yeah. So this is basically kind of your last resort, huh?
Yes, sir.
Let's turn on your back for me. And I'll let you tell our YouTube subscribers here in a minute how you found it.
Okay.
There we go. Which won't be much of a surprise to them. Okay. Now I want you to lay your head in my hands like you're sleeping. There you go. I got you. Perfect. Yes, sir. Good job. Now, just breathe and relax, because I'm going to decompress you from this end here first. Just relax your whole knee here. Let that leg go. There you go. You should have felt that in your knee all the way up into your back. Good. Okay. His knee stability is good. There you go. Did you feel that one up in your back as well? Good. Okay. So let's turn sideways and come over on this table, Marco. And I'm going to have you put your pelvis right here. Head up that way this time. On your back. Yep. Okay. So we already did his consultation and history and found out what's going on with all that. Americo sits and drives for a living all day long around Houston and other parts around Texas, so it's really bothering him doing that. He can't function normally in his everyday activities, so this is a big deal for your life, isn't it?
Huge.
So his reflexes, as you can see, are pretty equal and stable. The left one's a little better than the right one. So this is his very first spinal decompression. So this is a wet towel I've got here, and the reason it's wet, for all you guys that keep asking, is because I get a much better grip that way. There we go. Let you hit it for a sec. There you go. Now lay it back. Okay, now just keep your teeth together. Take a real deep breath in, and let all your air out. Okay, I got you. There you go. Oh yeah. Feel that all the way down?
Oh, yeah.
Yeah, there we go. You actually did real well on that. You didn't yell near as loud as most of our male patients did the first time. But watch this. Look how much better that reflex was. Did you see the difference on that right one?
I can feel it.
Yep.
Yeah.
Now you should have felt that all the way down, did you, Marco?
I did.
Good. Alright. So when we get up, I'm going to kind of help you up sideways and face over that way towards Renee. So what I want you to do is kind of grab my hand and bring your feet over to the side. We're going to swing you up sideways. There you go. Now let's get over this way just a little bit. There you go. Now, I want to check your shoulders and stuff. If you wouldn't mind telling our YouTube subscribers and sharing with them what you've been through and what brought you in here.
Well, I've just been going through a lot of leg pain, numbness, burning, lower back pain. Whenever I drive, whenever I sit, and I drive for a living, so that's a large part of my day. And it's just been affecting my everyday life. I used to play a lot of sports, and I want to get back into that, and I haven't been able to do that.
Because before the surgery, you told me you'd been playing basketball twice a week, right?
Yes.
And you were still able to do that,
absolutely.
Even with the herniated disc that you had
Even
at that
with the
point.
disc that
But
I had,
after
yes.
the surgery, you've not been able to do any of that.
No, I jogged a little bit, and it just started hurting.
So any of you people out there that have a herniated disc and have sciatica or leg pain or lumbar radiculopathy is called, okay, relax this. Surgery is absolutely the last resort. Don't go jump into that because you can't undo it once you've got it. You can't go back and undo that, can you?
No, you can't.
So if you'd have done this first and gotten well, you wouldn't even had to have the surgery, right?
Probably not. No.
Yeah. So stand up and just tell everybody how you feel right now compared to when you walked in the door.
Oh my God. It's like night and day.
Well, that says it all right there.
It's awesome.
Oh my God, we'll give him all the honor.
Yes, absolutely.
That's
Thank
good.
the Lord. Wow, thank you, Doctor.
You're quite welcome. Well, thank you for sharing your story with us. And this is Dr. Gregory Johnson and Americo here at Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.